Very good evening, everybody. Welcome once again to another episode of The Different News. Today, I'm going to invite one of a very eminent guest from the dentistry world. Well, before I get into and invite my guest and call in my guest back in the studio, let me see whether he has arrived or not. But before that, let me tell you that what exactly we will be discussing today in this episode. It is a fantastic and very hot area of discussion. It's all about the dental medical integration and whether it is a false hope or it is really going to become a reality or is it a reality. Well, without any more delay, I will invite my guest inside the studio, and then I will introduce and you will see that who my guest is. Welcome, Dr. Scott. It's wonderful to have you, and it's my pleasure and honor to host you on this podcast episode. Thank you so much for being here today.
Thank you, Dr. Goswami. It's a pleasure.
Well, I have a lot of questions. Just that, Dr. Scott, would we all know about you from the field of dentistry, but you have an extensive academic and professional career. And to for all my audience, at this moment, Dr. Scott De Rossi is the founder of Serendipity Partners, and we will know more about his incredible journey from himself. So, Dr. Scott, would you like to tell about your journey, what you have done, how you started, and how you are into Serendipity Partners at this moment?
Great. Thank you. I appreciate that. I've only recently joined, in essence, the private sector through Serendipity Partners as vice president. My career historically has been in academic healthcare. I finished dental school in the mid 90s and pursued residency training in oral medicine, which is really where my love and passion for medical dental integration began. Having stayed in dental school and having shown some level of proficiency for administration, I sort of rose up the ranks and had an opportunity to be a founding department chair of a department at then the Medical College of Georgia, which included a number of different specialties: medicine, pathology, radiology, etc. Then I became the 8th dean at UNC Chapel Hill School of Dentistry. And then after a term there, I had the opportunity, really once in a lifetime opportunity, to become a founding dean and start a brand new dental school at another institution, another university in North Carolina called High Point University. And after doing that for 3 years, transitioned from academic healthcare to trying to see if I could make a difference in really in the medical dental integration space on the private sector. And I can talk a little bit about that as we advance through the conversation. So again, thank you for allowing me to be here and share my story and my opinions, thoughts, and feelings on what is a very important topic and will continue to be an important topic for the profession.
Thank you, Dr. Scott. It's an incredible years that you've passed, and a lot of kind of different work in staying in the field of academics and attaining such a height of administrative positions. I think it's a pleasure again, an honor for me to host you in this episode. So I think it's a very close to my heart, a topic that we are going to discuss today. And I think you are the right person and the right expert to throw light on various aspects. So my first question is very simple: that how, if we want to define dental medical integration, how you think we should define this dental medical integration? What would be your take on this? Yeah.
Yeah, I mean, I think it is a great question, and it really comes down to at least my philosophical approach as to what this oral medical or dental medical or oral systemic integration is all about. And we hear about the things that are really gaining a lot of traction in both the scientific literature, but also in the lay press, right? Oral disease link to coronary heart disease, to stroke, to adverse pregnancy outcomes, to diabetes and bacterial pneumonia. But I think there's more to it. And this is where, as an oral medicine specialist, I think obviously those are important, but it's also related to the oral manifestations of systemic medications and drugs that people take. It's looking at the oral cavity as a place where oral lesions may be a sign of systemic disease and medical illness that perhaps is undiagnosed. It also is related to the value of oral health professionals, dentists, hygienists, and others being able to screen for medical illness in the dental office and help access to care and lower the burden of disease and early diagnosis. The reality is that advances in medical science are causing people to live longer and receive medical treatment for diseases and disorders that were debilitating or perhaps even fatal just a few years ago. And these individuals are maintaining their dentition longer. So we're clinicians across the globe are seeing patients with malignancies, with immunodeficiencies, with advanced heart disease, with organ transplantation, with polypharmacy. And so there's an increased burden on oral health professionals to understand medicine, and there's an increased burden on our medical colleagues to understand the importance of the oral cavity in everyone's overall well-being and health.
Yeah, of course. I mean, that's true that with advances in medicine or medical technologies today, lifespan, the survival rate, normal human lifespan also has increased. And today even we see a lot of tests that are coming up, and companies are working on, uh, things like age reversal, longevity, and stuff like that. So we are in a very promising time. But I agree to what you actually say. So to be very honest, I think, if I'm not wrong, we still have to work on a lot of things to actually get into a real speculative and practical approach of dental medical integration. So
Mm-hmm.
what do you think, as an expert, like what are the key barriers that are there that we need to really think about and overcome, to do this integration in a very seamless pattern?
Yeah, I mean, there are a lot of barriers. I mean, obviously, there is tremendous, irrespective of what country or what type of health system there is in the country you're in, there are still health system or healthcare system silos. And I think that obviously is one of the biggest barriers, that right now there's clear separation in many institutions between the dental and medical system. These are structural barriers, there are cultural barriers, and they really lead to fragmented care. And I think part of what we're talking about is the need for an intentional effort to either bridge these silos or to simply tear these silos down. Some of these silos exist because of insurance and reimbursement models, right? There is separation of dental and medical insurance companies in a number of different countries that complicates payment for integrated care. I think there should be a unified reimbursement model that allows for coverage of oral health in the context of overall health. We're still seeing, although it's improving, a lack of interprofessional training. Medical and dental education are still largely disconnected, even with the efforts of interprofessional education and collaborative practice. But I think dental school curricula needs to be reformed. I think it needs to include significant interprofessional training in areas, in clinical sites that actually are truly integrated, so that providers are we're developing their skills to help them collaborate across these disparate fields. And I know some of the other questions you may have perhaps are related to some of the other barriers, electronic health records, regulatory policy barriers. The fact that we don't have a lot of research showing that an integrated medical and dental environment or ecosystem would actually improve outcomes. I certainly believe it would, but there's growing research, and then obviously just cultural resistance to change, and the clinicians or the practitioners that are likely to resist some level of integration because of the established way of working, the established reimbursement structures, and perhaps even the concerns they might have about scope of practice, all represent big hurdles that need to be overcome to really achieve the level of medical and dental integration I think patients deserve.
Very true. I mean, I absolutely second your thoughts, and I think still, I think I'm very positive about this area. Why? Because I have seen, like as you said, definitely there are cultural barriers, there are mindset barriers, there are system barriers which we really need to traverse with time. Uh, at the same time, I have seen that young people who are coming into newly starting their practices, at least I have encountered many people like that. I mean, I'm talking about dental professionals who are aspiring, or even some people who are established dentists. They are trying to give some diversification to their dental business. So I have seen some kind of interest in terms of doing something more for the patients, not just sticking to our technical typical procedures that we practice in our clinical practice. So I think there is some line of hope which actually takes us towards a very positive side of dental medical integration. Having said that, so Dr. Scott, one thing, like you mentioned about electronic health records, and I'm sure that in today's technology driven time with AI and electronic health records and telemedicine, do you think that these technologies or these advancements will play some role in mobilizing the dental medical integration in a better way?
I think absolutely yes. I mean, obviously, historically, dental and medical practices have used different electronic health record systems, making the sharing of patient information very cumbersome. Not impossible, but cumbersome. We're going to see improved interoperability of these systems. We're going to see improved integration, at least in the United States and really globally. One of the world leaders in electronic health records in terms of market share is Epic. One of probably two of the most important decisions I made as dean, one at UNC and one at the Workman School of Dental Medicine, was actually launching Epic Wisdom and in both institutions, because I think it's critically important in order to really get that amount of medical dental integration that we need. We have to be literally on the same page of our virtual electronic health record. We can't be in different systems. It's not fair to the patient. We're not going to get the level of coordinated care that we need. We're not going to get the communication between the dental and medical providers to ensure a more holistic and patient-centered approach if we're not on the same system, right? It's going to reduce duplications, it's going to reduce errors, and it will promote a more streamlined approach to treatment plans that includes both the medical and the dental/oral approaches to overall health.
Thank you for answering that. Just for my audience, Dr. Scott, can you just tell us about, like, I follow you on LinkedIn. So I think if anybody wants to see your insights, you write every Friday. So that's a fantastic. I mean, I really love what you write. So I think to my audience, I really request that if you really want to get more wider visions and more promising, angles or know the reality, then I think Dr. Scott, you write every Friday. It's named as Friday Thoughts. Am
A
I correct?
Friday perspective. Yeah, Friday
Friday
perspective.
perspective.
Yeah,
Yeah.
and I appreciate your kind words on that. It's sort of interesting when I stopped being a dean and moved into the private sector. I realized I actually had a significant amount of more freedom to actually say what I actually thought without regard for what different constituents think. And I write on a number of different topics. Some of them are related to leadership. Some of them are related to management and operational excellence. Some are related to the dental industry and dental education, AI, and others. But it has allowed me an opportunity to really, now that I've transitioned into the private sector, an opportunity to really reflect on what are some of the important aspects of the profession and what are some of the challenges that we have in front of us. And I commend you for doing podcasts like this and other programs that you do, because I know they address many of the same issues. And I think those are important. I think those are important issues to address in any number of modalities and locations, whether it's LinkedIn or Facebook or others. So I commend you, Dr. Goswami, for doing the same thing.
Thank you. Thank you so much. Now, I have a little tough question, I think, but I know that yeah, you are the right person to ask that. When it comes to any new thing, like we're talking about dental medical integration, which is happening but in a very slow pace, and it's not like a regular thing that's at this point. I mean, at this present point. So definitely we need to talk about understand healthcare policies or regulations. So um, what what according to you, what changes in healthcare policies and regulations you think would be would help this combination to happen more in a more seamless or in a more smooth fashion, and
Yeah.
probably more people take it more easily rather than refraining from it. So, what is your understanding about this area?
Yeah, it is certainly going to be an uphill battle. I mean, in many instances, when you look at the necessary legal and regulatory changes that are going to happen, it's probably not at the speed it needs to be to move to the integration that I think we all hope for and expect and really think is necessary to improve patient outcomes. Part of it, again, is when we look at all these different hurdles or barriers or challenges, the silos, the reimbursement models, the lack of interprofessional training, the compatibility of electronic health records, all of those in many ways exist because of the regulatory and policy barriers that exist. The regulatory frameworks that govern medical and dental practice are different in depending on where you are in the globe and what country you practice. There may be more stark differences between those. Those regulatory differences complicate the implementation of integrated models of care. And so we're going to need significant changes. For instance, in the United States, we're going to need to see significant changes in how private and commercial insurances reimburse medically necessary dental care, whether it be restoration of teeth for edentulous patients with complex medical diseases or comorbidities that it's impacting their medical stability and overall health, whether it's sleep apnea. The list is going to continue to grow as we become sort of older and sicker as a population. And on the federal side, the federal government in the United States and the Medicare and Medicaid programs are going to need to evolve and to create a different understanding that we all have, right? Which is the evidence linking oral and systemic health is there. I mean, obviously, we need more robust research to quantify the long-term cost and health benefits of fully integrated care models. But there is no doubt in my mind, and I think the research would show this, that a fully integrated approach will reduce healthcare costs by preventing expensive medical treatments that are linked to poor oral health. So if dentists are playing a more active role in diabetes care and diabetes complications or cardiovascular disease triggered by untreated periodontal disease, that's going to help. And I think as we start to see more and more research coming out demonstrating those cost reductions, then I think the legal and regulatory changes will happen to ultimately get to an integrated system, a true system and coordinated care approach that we all desire.
Thank you. Thank you for your answer, because I think it's a very important aspect that we got enlightened about from you. So, of course, now as an educator or an academician, and you have been a true academician whole through your career. So, do you believe that we need to change the education and training of healthcare professionals in terms of when we are looking into this dental medical integration?
You know, it's a really hard question, and part of me wants to answer no, and that's the part of me that has sort of grown up in the dental school system, and then part of me philosophically can't really understand, can't grasp why medical school happens for some clinicians. And I'll give you an example: ophthalmologists in the United States that focus on diseases and treatment of the eye and vision go to medical school, and then they do a residency in ophthalmology. Why should the mouth be any different than that? Why is it that folks that focus on the eyes have a entirely different approach to their educational program, and yet the mouth, I think we as dentists have separated ourselves to some degree, and create our own schools, and then we don't go to medical school, and then we have our own residencies. I don't know if we're ever going to turn the clock back and change it entirely, but I certainly think there's an opportunity for more coordinated and connected interprofessional training between medical and dental, and I think there needs to be a lot of curricular reform to help educate physicians about the oral cavity and dentists about a number of different complex things. I mean, and the burden is significant. I mean, it is going, and I've said this as a longtime educator. Historically, it has been very difficult to kill a patient doing dentistry, right? That's the good news. The bad news is I think it's going to get easier to kill a patient. And the reason is because we're seeing changing demographics of disease. We're seeing increased prevalence of complex chronic diseases. We're seeing new medications being developed and brought to market daily that impact the provision of dental care. We're seeing new and emerging infectious diseases that are coming out. So there are new demands that are being placed on dental care providers and oral health professionals to have an increased knowledge of the dental management of these medically complex patients, as well as the evaluation and treatment of the oral manifestations of their systemic disease or their medical management. And so, what we do, what we know, and how we're taught it, I think is going to need to change drastically to keep up with these changing demographics.
Thank you for answering that. And thank you so much for giving such wonderful insights. And definitely, I agree that it's a lot of things to be done, but I think we can always hope for the best and we can always keep working in our own way. The things that we really want to see in the society happening at some point in the future. So, looking ahead, do you see dental medical integration becoming a reality, or it remains like more of a theory rather than getting into practice?
I think it's a wonderful question, and I think it's a very important question. And I think the answer is we will absolutely still continue to see oral and medical and oral systemic integration. There are silos within the medical health system that they still struggle with, and I think we're always going to continue to struggle with these silos, and we're never going to reach a perfect system. But all of the changes that we're going to see will continue to increase in scope, in magnitude, in speed. And so I think we will get to where we need to be eventually. And I think every day there's increased progress. It makes me think. So I'm half Greek, half Italian, very proud of each heritage, and I'm very proud of my Greek heritage. And the ancient Greeks, when you look at the writings of Plato, when you look at the writings of Hippocrates, they documented that physicians of that time, they were well aware that the mouth and the oral tissues were a barometer of a person's well-being. And I continue to see that realization manifesting in changes in the healthcare system, changes in education, changes in legal and regulatory approaches to patient care, and certainly changes in health outcomes for the people we care about.
Thank you, Dr. Scott. It was fantastic conversation, and I think a lot of things I learned from you today. And of course, my audience who are listening now or who will be watching this video at a later point, I think it was wonderful talking to you and knowing so much from you, and of course, talking on a very what to say, a topic which is very close to my heart, dental
Mine as
medical.
well.
I know, I know. So thank you so much, and I think we will have more conversations in the future. And I look forward to see you again and talking to you about all these things.
I do as well. Thank you again.
Thank you so much.